Thank you, Chair. Minister Philpott, I'm looking at the recent Auditor General report on the problems of the First Nation and Inuit dental. And the program can't really tell where they're yielding results. They're pointing to deficiencies that exist. And I refer you to one of your own departmental documents from British Columbia region that said that that in both for First Nation Child and Family Services and for First Nation Inuit Health Branch, that they were, quote, denying dental even in emergency situations. That was the BC report. I can give it to you if you want. And that, quote, more and more dentists refuse to deal with Health Canada because of the very long delays in getting paid. So given the fact that dentists don't want to deal with the department, do you think that that is a reason that we're having serious problems with the dental issues for First Nation children?
Well, as you know, the Auditor General's report spoke to the large amount of programming that we have for dental care and oral health, and I certainly appreciated the Auditor General's report and had an opportunity to meet with him. One of the challenges around oral health is that it has been severely underfunded in the past. So you look at something like the Children's Oral Health Initiative, which has been widely acclaimed as being very, very successful. We were only up until recently able to provide that to about half of the potential recipients because the program had been flatlined since its creation at $4.5 million per year. Thankfully, in last year's budget, we were able to receive an investment of $45 million over 5 years, which will essentially roughly triple the potential opportunities of what that program can do. There is, without question, work to be done on moving to a more outcomes-based approach of tracking the results of that program, but the department was unable to develop a new strategy and determine how that could be expanded and how they could change to a more results and outcomes-based because they did not have the funding that they needed to expand. And thankfully this is done, and the department is working very actively on developing that framework.
Well, it was a real honor to have you in our community. Kishetchewan, you've seen the conditions that the people are facing there. We have no dental services in Kishetchewan. We have children who are being fed Tylenol on a daily basis. I've contacted you about this, but this is ground zero of the failure to deliver programming to children in First Nation communities. So in terms of the situation in Kishetchewan, how do we transform this? If we don't have dentists who are going in, it doesn't matter how many studies are done, kids are suffering.
Well, thank you for calling that to my attention. As a result of you speaking to me about that and other requests that I had, I have had the opportunity to look into this situation. In fact, I had the opportunity to meet with Chief Leo Friday recently, and I had that meeting with one of my assistant deputy ministers. I raised the issue of why we're having trouble getting dentists and dental care for that community. And we acknowledge that, like many other parts of the work that we do, human resources is a real challenge for us, and getting these healthcare professionals to communities is very, very difficult in many cases. So there's still work to be done in Kishetchewan, but this is something that the senior levels of my department are working on to be able to address and determine how we can get better dental care in that community.
Thank you very much for that. One last question on dental. You're still fighting the Shiner case. We spent, Canada spent over $110,000 fighting this young girl. The rejection rates have been 99 and 100%. This has gathered international media. Why?
Well, I'm very happy to have further conversations with you. It actually warrants a longer conversation, but I will, as you know, be happy to clarify that, in fact, access to orthodontics care is not a universal benefit in Canada, but the First Nations Inuit Health Branch actually approves more opportunities for orthodontic care for medically necessary cases than any other public benefit plan in the country. But we don't provide, for example, access to care for cosmetic cases. So I
think just in fairness, that's not a cosmetic case when we're talking about chronic pain.
So let me
and someone losing her teeth, and she's 13 years old.
Let me explain to you the circumstances of this case is that we have criteria, and I want to make sure that we clarify the point, and I would appreciate you not mischaracterizing what the costs that the department has incurred. There's nobody fighting anyone in court. The cost that the department have incurred was to confirm that due process was followed and that the policy was followed appropriately. That has been...
So you're saying you haven't spent $100,000 on legal costs?
There have been costs in the department, as in any, when a public government establishes a benefit plan of any form.
I understand that, but
$100,000
against a girl for a case that would cost $6,000.
This has
when
been
you have rejection rates of 99%.
Repeatedly addressed, and it has been affirmed that the policy benefit plan has been followed appropriately. Like all other aspects of the non-insured health benefit plan, this particular part of the policy and everything else are constantly something that we look at and determine whether there need to be policy changes. We're in an active process of that in our government, and we will look forward to further conversations about the policy.
And so they will be back in court in January, February, so we can assume there will be more costs to Canada?
As I said, this is something that I am following. We want to make sure that we have the right and responsible policies associated with the non-insured health benefits plan, but I can assure you that the policy was followed appropriately in this case, and that's been reaffirmed on repeated occasions.
In terms of the Canadian Human Rights Tribunal ruling, I'm pleased to see movement on Jordan's Principle, which are still in non-compliance on child and family services. There's still serious concerns, and Parliament and both ministers voted to move that $155 million shortfall that was identified, and that money did not flow. Actions matter in this. Why did your department ignore the order of Parliament to flow that $155 million to get funding into a very, very broken and underfunded system?
Well, very short. So, you know, again, I'm happy to give you further details at another occasion. This is a really important issue, and you know that we have put hundreds of millions of dollars into addressing Jordan's Principle and child welfare, new money that wasn't there before. There is much more work to be done on child welfare. That's why I've called an emergency
meeting. The child welfare money has been identified by the Harper government. You're just following through.
Questioning now has to move to MP